Hello and welcome to hashtag our Doc Talk. We're here today talking about COVID-19 with Chief Medical Officer Seth Kaufman. Take it away, Dr. Kaufman.
Hey, thanks, Robin. Good morning, everybody. Happy Thursday. Thanks for joining us. We are meeting either every 2 weeks or sometimes every month, depending on how much new information there is. And what I'll do today is start with the numbers, which are very encouraging. There's a few hot topics that you can probably predict what I'll be discussing around the vaccine and restrictions, and then we'll go right into your questions. So let's start with the numbers. They're great. They're great. You know, the biggest drop we've seen since the beginning of the pandemic. Here at NorthBay, we've, our hospitalized patients, it's some of the lowest numbers we've had since really the beginning. And remember that we were, unfortunately, very early on, we were involved in the COVID pandemic, having the first community transmission case at NorthBay. So we're real veterans and experts at COVID. But some of the lowest numbers we've seen really, and that has been a decrease over the past month or so. Same in the county. So the 7-day positivity rate right now, as of updated yesterday and on the Solano County public website, is 6%. We were more like 25 to 30% in early January. So that is a really substantial drop. Currently, as of yesterday, the number of hospitalized patients in the county sits at 37. Also very, very low compared to the 170 cases that were hospitalized again a month ago or so. So those are really encouraging numbers, What does that mean? What's going on? It's what we're seeing, in my opinion, is both a combination of kind of the post-holiday effect. So we got through the holidays. I think there's been a lot of compliance with our preventative measures, mask wearing, distancing, good hand hygiene, some of the shelter-in-place restrictions have had a good impact, and that's dropped our cases. And then absolutely part of this impact is vaccinations. So we here in Solano County, a lot of great effort from our county, from our other healthcare colleagues, from our pre-hospital colleagues, our medic ambulance colleagues, and others have done an amazing job vaccinating some of our higher risk patients, our nursing home patients, and others. And that has definitely had an impact on our case rates and the number of patients that are getting severely ill from COVID. So with that, I want to talk a little about what this all means, I read the papers like you do and the news headlines, and I thought I would try to just kind of summarize it for you a little bit. We in California, we have vaccinated about 17% of the state. That's okay. That's nowhere near herd immunity. That's not going to end the pandemic at 17%. We know that with the limited vaccine supply and going through the tiers, it's really been the higher risk individuals, older, right, nursing homes that have been vaccinated. That's really helpful because those are the people that get really sick from this disease. So with that, a reminder that if you want to get vaccinated, I would highly recommend that you sign up for it, that there's two things you should do today, right now. You should go to the Solano County website, so it's solanocounty.com, and there's a few clicks. You click on COVID update, then you click on COVID vaccination information, then you'll see there's a vaccine information form. It takes like 30 seconds to fill out, and it asks what your age is and a couple pieces of information. That's one way. You may get a call. You might be surprised as we move through the tiers in the next few weeks. You may get a call, text, however you'd like to do it, that asks you to essentially sign up for an appointment to get vaccinated. That's one thing to do. The other thing to do is that it's anticipated in the next few weeks. It's already starting in certain markets that will start using the myturn.ca.gov website. The state is moving towards a centralized appointment system, centralized way to distribute vaccinations. A lot of counties, including ours, are in transition and working through that, but you should sign up. So go to myturn.ca.gov. There's a little button that says check if you're eligible. Fill it out. You don't have to be eligible right now to register, and then you'll have it out there. So you should have your vaccine information sheet out there on the solanocounty.com website. You should fill out you should register with myturn.ca.gov, and then you may be surprised. You may get a text, a call, an email, and have an opportunity to sign up to get vaccinated. The other hot topic for today is discussing kind of restrictions and where we are, and some of the news stories about states loosening their restrictions. At 17% vaccination rates in California, with the variants that are definitely prevalent and with still kind of, we're kind of in transition, figuring out, determining how protective the vaccine is against these variants. It is now not the right time to just throw off our masks and run and hug everybody. I think there is, if you're vaccinated and the person you're seeing is vaccinated, and neither of you are really at high risk, so you're young, healthy, high risk for getting sick from this illness, because you can still get COVID through the vaccine. It's just much more rare, and it's a little less rare with the variants. Then you could probably be a little looser. Dr. Fauci said that. Others have talked about that. I anticipate more formal guidance from the CDC on loosening restrictions for those that are vaccinated in the coming weeks. What that looks like, I'm not sure yet. I think they're analyzing the variants and deciding how they could put out safe recommendations and avoid another spike. Are we at risk for another spike? We are absolutely at risk for another spike. We don't have enough people vaccinated. The key is to maintain and be patient. And it's so hard. It's hard for you. It's hard for me. Keep the mask on. Be extra diligent, whether you're vaccinated or not vaccinated. And let's wait a few more weeks and see what comes out. Data around the variants, guidance from other countries that are a little farther along than we are, like Israel and other places. Information about the South African variant that we know is in California. I think all that will be really helpful. I'm completely optimistic. I think that there'll be enough protection from the current vaccines to keep kind of things low. Maybe there'll be a little spike. All that's really still dependent on our behavior as individuals and the speed in which we can vaccinate our community, our county, our state. So those are the big variables to me. I think the variant variables are significant, but we can overcome them with behavior, the behavior of individuals, and speeding up and continue to expand our vaccination efforts. Okay, so that is my spiel for this morning. Robin, what kind of questions do we have?
Well, we had one come in by email, I think it was yesterday, a person who had gotten their first shot.
Yeah.
And then people in their family got COVID and they were having signs and symptoms, and they didn't know what to do about coming in for their second shot. So can you talk about what happens if you're exposed between shots?
Sure. I'm going to expand that question. So first of all, let me repeat the question. The question is I got my first shot. My family, I'm sick. Maybe it's COVID, maybe it's not. Should I go in for my second shot? I'm even going to talk a little about what do you do when maybe you're vaccinated and you get sick. So let's talk all about vaccination and COVID. Number one, the vaccine does not cause COVID. 100% does not cause COVID. So if you're unfortunate to get COVID somewhere in the middle of your vaccine regimen, it's just a bad coincidence, right? So we call, right, there's correlation but not causation, right? They're correlated because they were in proximity to each other, but they didn't cause each other. And that's true for a lot of things, right? So, and it's, the human mind, we like to think like, what did I do recently? I got a COVID shot. I got COVID from the vaccine. But it's just not true. It's not possible. So that's the first comment. Second comment is that you shouldn't, because you'll infect everybody. It's not dangerous, but there's two reasons not to get the COVID vaccine while you have COVID. One, or sick at all, by the way. One is that your body is already fighting an infection, whether it's COVID or strep or the other viruses that we've all forgotten about, but they all still exist. You don't want to get immunizations while you're sick with something. The theory, mostly, I don't think there's a lot of data on it, but the theory is that you won't be mounting a strong, robust response to the vaccine because you're fighting an infection. So the other reason is just you're going to walk into a vaccine environment where there's elderly people sick, getting their COVID shot, and you run the risk of getting everybody sick. So you need to wait till you're well, out of your isolation period. Whether if you got your first shot and you got unfortunately sick with COVID, you need to wait, even if it means you're lapsing on that 21 or 28 day interval for the Pfizer and Moderna vaccines. You should wait, and that's okay. We know there's more and more data showing waiting a little longer may be beneficial. We don't even know. So, but it's not going to hurt your chances of being protected from the vaccine. So, if you got your first shot and you got sick, get tested, see if it's COVID. Even if it's not COVID, wait till you're well, then reschedule that appointment. If you went through both your shots and you're out, let's say a week or two from your shots, you should be really protected. If it's not a variant, you're 95% protected, 95% protected, and you get COVID, that's probably because it's not 100% protective. You got COVID. It also could be a variant, and we are sequencing. We're taking those samples and sending them to the state or our county lab and getting them sequenced. Talk to your doctor about it. I'm sorry. It's probably frustrating. You're probably like, I got vaccinated, now I got COVID. It's going to happen. It's just going to be rare, but it's going to happen. And the good news is that for Moderna and Pfizer, and I'm happy to talk on this call about Johnson & Johnson, we don't have any here at NorthBay at this stage. The county does not have any yet, just so you know. Lots of discussions, public discussions around Johnson & Johnson. But for the ones we're still using today, Pfizer and Moderna, we know that they're essentially 100% protective against getting sick from the disease. So in both the phase 3 trials and what we're seeing in other countries, and what we're experiencing anecdotally, which means I don't have data, but we know for sure, is that the vaccines are protective against really getting sick and dying from the disease, even if you get COVID. So in the cases of people getting it after the vaccination, probably frustrating, but probably still protective. Like, you could feel confident, like I'm probably highly, highly, highly unlikely, pretty much 100% chance I'm not going to get really sick from COVID, which is what we care about most. Which, by the way, is Johnson & Johnson. We don't love the data necessarily on its protection against the variants, and we love to see a little higher numbers on its protection against the first COVID virus. But we know that it's very good at keeping people from getting very, very sick, hospitalized, death, which is what we care about. If COVID has caused a mild illness for everybody who got it, we would not be in this predicament. The problem is that a lot of people die from this disease, as you know well, right? We crossed that 500,000 threshold recently. So I've gone off a little bit off the deep end on that question, but essentially it can happen. You can get sick even though you got COVID vaccine. You're probably not going to get severely ill from that. Don't go in and get a second vaccine or first vaccine if you're actually sick with anything, including COVID. I will stop there. Yes, okay. Robin, next question. I see she has a whole list here.
Jean is curious about if there are plans for a COVID vaccine location in Vacaville that you know of.
That's a question. I don't have the list in front of me. There have been some vaccine clinics There was some vaccine clinics in Vacaville. I know that the county is trying to. A couple things are happening. The county is setting up in different locations. So that's the first thing to know. I still don't have the list in front of me. And healthcare systems, including ours, are trying to do our best to set up clinics in their places. So the answer, short, is that we are aware that people would like it closer to where they live or work, and we are trying our best. And I know the county is setting up clinics in different locations. I don't know the next time it's in Vacaville right now.
Beth is, when will people age 50 to 64 be able to be vaccinated?
When can people who are 50 to 64 get vaccinated? I hope soon. So the state says by March 15th, you should be able to move down tiers to start vaccinating those who are 16, which is the minimum age for the vaccine, for one of them at least. So essentially the earliest age possible, to 65. Start vaccinating those group who have underlying medical illnesses, and there's actually a whole list: diabetes with certain hemoglobin A1Cs, kidney disease, those who require oxygen because of a pulmonary illness, a chronic pulmonary illness like COPD, and others, cancer patients. So that will be March 15th, although we're hoping that we can move down even a little earlier. So it's coming. Now, if you're a 50 to 65-year-old and you're healthy as can be, it's coming for you too. I think it's going to be soon. I just don't know when. But age-wise, we are going to drop under 65 very soon. It may be March 15th, which is not that far from now, right? It may be a little earlier from that. NorthBay is ready. I know our health partners are ready. The challenge right now, or it's not really a challenge, but the reason why you don't see us doing it right now is because we have to continue. The mandate from the state is to go through the tiers. So right now, we continue to work through educators, food and agricultural workers, other higher tier individuals, whether you agree with the tiers or not, that's what they are. And so that's why we have to exhaust those tiers before moving on to the next one, but we're very close. So I hope that helps.
It does. Heidi says, would you consider someone with chronic condition, including mixed connective tissue disease, to be considered high risk for COVID? And if so, do you recommend continued strict quarantines?
Okay, so the question is this individual has a connective tissue disorder, and do I consider them high risk for getting COVID? And if so, continue with strict kind of quarantine rules, whether you're vaccinated or not vaccinated? It's not an easy answer. It depends on what medications you're taking, the type of connective tissue disorder you have. Some affect the lungs, and that could have an impact. So honestly, it's a tough question for me. Some of these questions about illnesses I really want to answer. You know, I'm an ER doctor, but it's you can't. It's hard to answer the questions with just knowing a little bit about your medical history. So I would tell you, talk to your primary care doctor. There is a decent chance that you are at higher risk. Now, if you're talking about am I higher risk, and that means I'll qualify for the vaccination. The state is very specific on their medical conditions. But there is some leeway for clinician discretion, physician discretion. So talk to your doctor, and as we expand into less than 65 years old with medical conditions, they'll help you guide you whether you meet criteria to get vaccinated. There may be a chance, this is a little more crystal ball, but President Biden talked about having enough vaccine for every American who wants it by May. I mean, I don't know. Every week there's different information about how we're going to try to expand the tiers. So maybe the medical condition stuff will not really come to fruition. I think it will. Maybe it'll be for a short time. Maybe we'll go to straight age-based. Your guess is as good as mine because of the amount of how dynamic the information is. It just changes on a weekly basis. But in terms of connective tissue disorder, it's the same as other type of diseases. You could ask me, hey, I have cancer. Are you on medications for cancer? Is it current? Is it active? I would tell you to talk to your doctor about those kind of things.
Kathy's wondering, is high blood pressure considered one of the high-risk categories?
I don't think so. Congestive heart failure is. Kathy, I don't know 100% on that. I'm pretty sure high blood pressure on its own without anything else is not.
She's asking also, where do we find the list of medical conditions for
Yes,
vaccinations?
it is on the CDC website. I will come back in 2 weeks and tell you exactly where it is. I can find it very quickly, but I can't do it on this call. If you could just start Googling it, you'll find it. But it is on the CDC website, it's on the state website. But it's a little hard for me to tell you over this how to navigate it. But it is there. It is there. If you just typed medical conditions for COVID vaccine, CDPH, which is California Department of Public Health, or California, you'll see it'll pop up somewhere in there. I'm so sorry. That's a horrible answer, but that's what it is.
That's all right. Someone was asking about Sonoma County, but I don't think we know when Sonoma County is going to get vaccine for the 65 and plus, do we?
The question is when is Sonoma County getting vaccine for 65 plus? I don't know. I know my own county really well. I'm on all those calls. I'm in constant communication with our county health officer. I don't know about other counties. It shows you, though, I'll get on my other soapbox, that there is some, as the state tries to create a standardized process across the state, you could see the value of that, right? Should somebody in one county get vaccinated if they're 66, but in another county, it's just not there yet. Like, what's the difference, right? And it shouldn't be that way. And that is what the state is working towards, is a uniform system where you could be anywhere in the state and the vaccine clinics around you are vaccinating the same group. You could actually go there. You can make an appointment online through myturn.ca.gov and go. If you're on a trip somewhere, you can get your second shot there. That's the idea, is that to create a uniform process across every county, and it's coming. It's coming. It's starting in waves. It's already in certain markets in Southern California and other places. And there's definitely been some bumps in the road, and they're working it out. But that is what's coming, just so you know.
And they're also curious about, do you have a choice of which vaccine you get?
Do you have a choice of which vaccine you'll get? For Moderna and Pfizer, I'm not aware of any system where you have a choice, other than you decline getting it and you kind of wait and see if you have a choice. I know here in Solano County, again, I know Solano County, the mass vaccination clinics that we have, mostly at the Vallejo Fairgrounds, but there's been some satellite pop-ups. Some days is Pfizer, some days is Moderna. The majority has been Moderna, but depending on what the supply looks like, there's been Pfizer. So I'll just tell you, soapbox number 3, it shouldn't matter which one for you. I know some don't like the 28-day interval. They want the 21-day. Maybe there's some data on side effects and stories out there. It's all pretty similar. It's a similar technology almost. My advice to you is it doesn't matter. It doesn't matter. Johnson's a different story. Yeah.
And you can't mix and match. You can't go get Pfizer first and Moderna second.
CDC's recommendation, strong recommendation right now, is not to mix and match. That might change. People have had to. It's not like it hasn't happened. They've been forced to. They just had to make. But the push right now is not to. And honestly, if you got your first shot, there's enough of both in our county here where you should be able to find an opportunity to get the same shot, even if it's somehow something happened with your second shot. But we're really trying to do the same shot. The idea is to follow the study guidelines that showed that 95% protection.
Okay.
That's the reasoning behind that.
Great. Is it safe for a person on a drug like Humira to get vaccine?
Is it safe?
Yeah.
Okay, so Humira is a immunocompromising medication. Is it safe? And yeah, that's not a contraindication to getting the vaccine. I think these are, again, good questions for discussion. Email your primary care doctor, but that's not a contraindication. In other words, you're allowed to get the vaccine, but talk to your doctor.
Okay. Sorry.
A lot of questions. This is good.
There is.
This is good.
What are the pros and cons of taking Advil or Tylenol when you receive the vaccine?
What are the pros and cons of taking Tylenol or Advil when you get the vaccine? That's a very good question, and it's a tough question. There's some really good tough questions today. Our scientific organizations out there that are guiding this feel pretty strongly about prophylactically, so taking medication ahead of these vaccines because of concerns and some data showing it suppresses your immune response. So that's ahead, before. So you're an hour from your vaccine and you pop, a gram of Tylenol, you pop, 600, 800, 400 of ibuprofen, Advil, Motrin, all the same medication. There's concerns there that you're it's acting as an anti-inflammatory, so it's suppressing your immune system. That's how it brings your fever down, things like that when you get sick, and takes your body aches away. It's an anti-inflammatory, and is it suppressing your immune system so that when you get your vaccine and the antibodies are trying to rev up, that you're not going to have the same response. That's the concern, and you shouldn't. And you shouldn't. It's a good concern. Once you've had the vaccine, there is less strong evidence, but there is kind of understanding that you should try, if you're not having severe side effects, try to hold off taking the antipyretics, anti-inflammatories, the Tylenol, ibuprofen. Again, with the same concern. Again, strong commentary from our organization, some data around not taking it ahead of time. After you've taken it, the idea is to really not take anything if you can avoid it, if you're just having mild stuff and it's tolerable. If you're having pretty severe symptoms, if you have a high fever, you're not feeling well, you're going to get dehydrated, If it's really bad and you have to, take it. It's once the farther out from getting the vaccine, the chances that it really affects your titers or your immune response is lower. And if you have severe symptoms and it's too uncomfortable and staying hydrated is not fixing it, you're getting dehydrated from a fever, you really need to function and you can't, taking maybe a low dose, just do your best to try to minimize it and not take it if you can. So I hope that helps you. Take it if you don't take it before when you're feeling fine. If you really have to, take it during, and we'll go from there.
This is a more specific to NorthBay question. Can a person who's a patient at NorthBay for hospitalization, lab work, and tests, but has a primary doctor outside of NorthBay, still get vaccinated at NorthBay?
Yes. If you've been hospitalized at NorthBay and you have a primary care doctor outside of NorthBay and you met a tier level, which pretty much right now is 65 and over, then you should have heard from us. We are by invite only, and we're doing much more than our own patients. We're doing as many as we can, but in there also is contacting those that have touched NorthBay in some way, whether you've been a patient of our primary care clinic, a patient of our specialty clinics, even if you weren't part of our primary care clinic, or you were hospitalized at NorthBay. Then as long as you're well and you meet criteria, then you should have heard from us, unless we just have no contact information for you that's accurate.
Can you talk a little bit about the side effects from the vaccines? And are there any statistics on how many really bad reactions there are nationwide or anything like that? Do you know? Yeah,
so the question is tell us what you know about side effects, current side effects from the vaccine. So so it's very common to have soreness in the arm, like 80 plus, just a lot, 80 plus percent, 60, 80%, just a lot of people have soreness in their arm, just like you would with the flu. What's worse than the flu, though, flu vaccine, not flu, but flu vaccine, is that it's much more common than flu vaccine to have headaches, body aches, fever. I had those symptoms from my vaccination. It was about a day long. It was, I would say it was uncomfortable. It was not mild. But I wasn't concerned about it. I knew it was going to come and go. In some ways, I was like, hey, my body's reacting. I'm getting my antibodies revved up. And it went away as quick as it came. Kind of came on quickly. I remember feeling like, I don't feel well, about 6 or 7, maybe 8 hours after the vaccine. And that, by the way, there's a wide distribution of that. It could happen hours after. It could happen the next day. And then it really got severe pretty quickly. And then it went away as quickly as it came. And I felt fine. So very, very common. You shouldn't fear it. Don't take Motrin and Tylenol before getting your vaccine, and pretty common. In the United States, the CDC put out in their weekly MMWR report, their weekly morbidity mortality report, a few weeks ago, a little less than a few weeks ago. They put out data from the first around 14 million vaccinations from December to January, the first month of our vaccination program in the U.S. And about 4.5 per million people had anaphylaxis. That is very low. It's a little higher. It's higher. It's not even little. It's a little high. It's higher than flu, which is somewhere in the 1 to 2 per million, but very, very low. 4.5 per million. 1 million. So a city of 1 million people, 4 or 5 people get anaphylaxis. Every vaccination clinic is ready to deal with that if they have to. There have been no other serious hospitalization level, death, anything else that has been correlated with the vaccine. I talked at the beginning of this talk, there's a caused by the vaccine. I just said correlated. Caused by the vaccine. People sometimes are like, this person got the vaccine and then they died weeks later or a week later. That's because people die and things happen. There's been no causation where someone got the vaccine and something horrible happened in relation to the vaccine, short of these anaphylaxis, which have been treated, can be treated. Everybody's ready for them with the EpiPens. I can tell you at NorthBay, we've done a lot of vaccinations. A good portion of the county has been vaccinated by NorthBay, and we have not had any patients requiring an epi shot. So anaphylaxis is always the talk. Nothing else has been found. We have United States data with that. And of course, we have worldwide data also showing that it's very safe.
Okay. How about our facilities and coming in and being afraid to come in because of COVID?
The question there is what is it like coming to NorthBay Healthcare these days, whether you're coming to our clinic, our urgent care, one of our amazing specialty clinics, our 2 hospitals. It is very, very safe. We haven't changed anything here, despite the fact that we have very few cases of COVID right now. And we will at some point, but right now it's still, everybody, you'll get screened when you come in. You should be screened. Mask wearing is mandatory. We have strict visitor policies that we are slowly starting to open up with our other healthcare partners and with guidance from the state and the federal government, so that we can safely allow visitors back. We want visitors for our hospitalized patients back as soon as can. There are some criteria where you're allowed to come and see your loved ones here. My point of all that is that it's very safe, strict mask wearing, amazing amount of cleaning, and you are safe coming to NorthBay Healthcare for your care. If you're allowed to come and visit somebody with our strict visitor criteria, then come on in. And you should know that we're constantly looking at this, and we hope to be able to loosen some of our visitor criteria soon. And there will be no stopping us being strict on hand hygiene and cleaning and mask wearing and distancing, all those really helpful things for now.
Okay, you talked about this a little earlier, but Becky is asking, when do you foresee us moving into the next tier for vaccines, and do you know the age group that will be?
Okay, so not asking about county risk tiers, talking about vaccine tiers. So by March 15th, we will be moving down a tier into that 16 to 65 age group with underlying medical conditions. It could be broader than that. I don't know if the medical condition stuff, which I think is a challenge in terms of filtering for that particular group, will be better than that. That will be by March 15th, which is around the corner. It could be earlier than that, but I don't know. So
okay, is someone who cannot receive the flu shot able to get the vaccine?
It depends on why you can't get the flu shot. So I don't have if you can't get the flu shot, can you get the COVID vaccine? These are different vaccines. Chances are yes, but talk to your doctor about what the issue is. Do you have anaphylaxis to a component of the flu vaccine that's also in the COVID vaccine? They are really different vaccines, and it's unlikely that it's an issue, but I would talk to your primary care doctor, send them an email, maybe they can clarify for you pretty quickly.
Will we have to get an annual booster even if we're fully vaccinated now? Do you know?
Will you need an annual booster if you are fully vaccinated for COVID now? I don't know. That's a really good question. Crystal ball tells me that we'll need a booster at some point, whether it's to cover the variants or because of waning immunity. That's my crystal ball, though. I don't know for sure. So that's my answer on that one. Thank you for joining us today. We're going to see you in 2 weeks. That'll be March 18th. We'll see you here at 10 a.m. Thank you so much.
Thank you, Dr. Kaufman.